Thanks, everyone. This day is a long time coming. For me, 36 years when I first came here. And I wanted to mention that because I feel that a lot of you out sitting here today to witness this probably share the same kind of concerns over the years and how we coalesce, how we pull it together, how we make good things happen. Sometimes it's darn lucky, and sometimes it's hard work. But the sensitivities, at least that I've noticed over the years, have always been there. And the caring has always been there. The desire to want to take, in our case, my case, the architecture, the design communities, and pull them together with the scientists. It just seems so obvious that this needed to be done. When I say scientists, you look around the room and I see all the nice doctors out there, and that's good because it all kind of comes together. And I think that what you'll see as a result of having created the HiBR is that it is no one hero. It's a team of heroes. And I think that we're just, in a sense, blessed to have found one another in some way, shape, or form over the past 3 years in particular, when we had our first exposure. Oh, thank you. When we had our first exposure to the possibility of bringing these kinds of mixed disciplines, mixed bags together, and give them an opportunity to have their say around our roundtable, and essentially that's what we do. So once a month, we have a roundtable members meeting. Many of you are aware of that, some of you not. But you're certainly, if you have the interest, are welcome to join, as long as you have and share the passion that we do. We're going to make some good things happen, and we're going to make them happen together. And today, thanks to Jim Whitehead, bless you, man, who last May said, you know, you guys are ready to go public. And we never really thought about it. We were just so busy doing what we were doing and the way we were doing it, we never really thought of bringing it out to the public. And so this is an important day from that point of view, from that aspect. Okay, now, I'm going to have to read you the ground rules, because today we're really tight on time, and I wish I could say more and more about the past, and at some point we might do that. But for today, I want to talk to you about what you're going to hear about and see about, and the time limitations and the constraints that we've had to put on all of the speakers. We give them 5 minutes, essentially, to cover their area. In many cases, they've taken their shows and their presentations that are much larger than that, it's half hour or more, and ask them to compress it into 5 minutes. So you're going to be getting snapshots of a broad range of activity. You're going to meet these people, and if you haven't met them before, and you're going to have the opportunity to discuss it further, privately, away from the activity here today. But I even have to put that constraint on myself. So with that, I certainly wanted to do at least one major thank you, and that is to Michelle Cooley. Michelle, who has, as my co-chair and working with Jim and his team, has been absolutely a knockout in terms of work production, detail. She was the only one we had, frankly, who had the experience in conferencing. And so we absolutely had to lean very, very heavily. Oh, I have to do 2 more. I'm sorry. Without Kenny, we wouldn't have pulled this off. Kenny Floyd, who picked up on the ideas and the ideals and the theories and the concepts early on, has been behind this program 200% in his quiet way. He has, and further to Susan Hinton, who is another person. This is the last thing she wants to hear because she really is quiet and behind the scenes. But if not for Susan keeping me sometimes chained to my chair to get out the things that need to be gotten out in a more timely fashion, because I tend to be a dreamer, as many of you know. But the fact is that this is what it takes to make all of this come together. Okay, I'm going to start with our speakers in the first group. Yes?
Close to the microphone.
Oh, close to the microphone? Okay. I have the same problem. Okay. If we can get started with our first session, that would be actually what I'd like to do. You can tell we didn't have a dress rehearsal. I'd like to get everybody up, first and second sessions. I notice we do have enough seats, I believe. That would be so that we don't have to break and save that extra 5 minutes. Okay, so we'll call up Charlene, Whitney, Bill. Get him out of his corner back there. And Lisa. Please come up. I'll keep the microphone. Okay, so we're going to start. Let me get my notes here for a sec. Really don't need my notes for you. With both Doctors Charlene Bayer and Whitney Austin Gray. Both of them are founding members of are members of our core group, which provides guidance and leadership as we continue to pursue our HiBR goals. Charlene holds her PhD in chemistry and is chairman and chief science officer of HiBR. Got that right, sciences. And Whitney holds a PhD in public health and is the health practice research director for Canon Design. Both will give you insights as to how HiBR began and its intended purpose. Charlene. You can actually use your speaker.
Honey, you forgot to tell everybody to stand up. You forgot to tell everybody to stand up after each talk.
Oh, okay.
Do you want me to talk over there?
Yeah. Okay, just, yeah. Huh?
I can't change the slides. I gotta go.
Okay, go with it.
I'll tell.
I just want to mention one thing. What we're trying to do to make it easier, and because there's a lot of different disciplines and a lot of different programs to be presented, the moderators have been asked to capsulize on what you heard and what the next group is going to provide right on down the line, just to make it easier to kind of stay connected. Is that it? Yeah, okay.
We also decided that one of the things that we're pushing is exercise and movement. So we would like you to stand up after every speaker and give them instant gratification and a standing applause. Okay? Thank you. All right. We wanted to let you know a little bit about how HBR started and what's our mission and who we are and how we're trying to get this movement forward. This started initially from a health session that I organized for USGBC Federal Summit 3 years ago. Charles was in the audience and said, let's do something. So here we are. So what we're advocating is a paradigm shift in our attitudes. We want to look at buildings holistically. They are systems. People are part of the systems. So we need to design the building for the whole person. This means that we want to design the building for health, not energy, not light, not for any single thing, but what are the things that contribute to health? So to me, it's analogous between indoor air quality and indoor environmental quality. Indoor environmental quality brings in some of the soft things as well as the pollutants. So we're trying to expand to a larger area. So if you need an economic reason for this, people are our most expensive things in the building. It is not energy. Most large facilities spend less than 2% of their budget on energy, but their salaries are extremely expensive. We spend a tremendous amount of money on healthcare costs, and a lot of these healthcare costs are caused by poor exposures, things that are going in the building. I am short. I cannot convince Georgia Tech to give me a desk. That is short. So I actually, to be able to have my feet on the floor at all in the desk that they did give me, I pile things up to put my feet on. That's stupid. I mean, it's a very simple fix. Okay, so our challenges are, how do we achieve energy efficiency? Energy efficiency is very important, but we have to do it and have a healthy environment at the same time. To me, the biggest issue that we have to solve immediately is, how do we measure health? Right now, we do it primarily by absenteeism, and I don't know about you all, but everyone I know takes at least a few days for mental health that has nothing to do with I'm sick. You know, we have to come up with sustainable strategies, and we have to really understand what's the interface between productivity and health. We need to fill these knowledge gaps. Most of the data we have right now is really anecdotal. It is not causal data. We need to move towards causal data. And I hope that we're going to hear a lot today. How do we justify this? Especially since most of our buildings are spec buildings. In the government, they're not, but outside of the government, they're spec buildings. They don't know who's going in there. How can the builder justify this greater expense? And then the biggest issue, which I know one of my speakers is going to talk about, how do we communicate? We have developed a language to communicate energy efficiency, but we have not developed a language to communicate to the poor person putting the building up on how this is going to affect health. So this gives us our challenges. We need cross-disciplinary research, transdisciplinary, as Whitney likes to say. We need clusters of health studies. We were talking a lot about that last night. We need to understand the economic consequences. So there are a lot of parameters in the building that affect health. These are just a few of them. I think one of the really important things is you need to understand is stress. There are a number of guidelines. Most of these guidelines do not address health at all, especially ASHRAE. ASHRAE will tell you not immediately that they totally ignore health. They do not intend to work on health. I am an ASHRAE officer, and I am in their face all the time about it, and they shoot me down. I will probably never win that argument. So HiBR is born. So we can bring in all these disciplines and take care of this and start looking at all the different things that impact our health and how we can. Jane Ward, who you'll hear in a little while, made the statement, what we need is a building that's like it doesn't have walls. Now Whitney's going to talk.